President Trump declared the opioid crisis a national emergency as tens of thousands of Americans die from drug overdoses each year. And now Texas lawmakers vow to hold more prescribers accountable, and soon doctors and patients will see changes in Texas. Here's what the president of the Texas Medical Board had to say. This is the takedown of a massive pill mill operation just weeks ago.
It was not just doctors, it was some physicians, some nurse practitioners, some pharmacists. It was a wide array of folks.
Dr. Sharif Zaffron is talking about the DEA raid in Houston that resulted in the arrest of 41 people, allegedly responsible for the distribution of 23 million oxycodone and hydrocodone pills, among others.
The vast majority of folks who overdose are typically doing it on illicit drugs like heroin or synthetic fentanyl. But we do see folks overdose on prescribed medications that are used inappropriately. You see it a lot with oxycodone, which is a medication that you find in Percocet.
To crack down on illegal use, the Texas Medical Board implemented new requirements. Dr. Zaffron says that would hold both doctors accountable and help physicians keep track of their patients. That process is done through the Prescription Drug Monitoring Program. It's been around for years, but starting March 2020, every physician will be required to check the PDMP before prescribing pain pills.
And very specifically, we look at, has a patient received 5 different prescriptions from 5 different physicians? That right away is a red flag. Doesn't mean that it's something wrong, but it allows us to go in there and look a little bit more in depth.
Another major change is limiting the number of days allowed for certain prescriptions.
The way it's defining it, it says that acute pain, you cannot get a prescription for more than 10 days without having to go back to the physician and be seen again and be evaluated again, and then if need be, have a new prescription written. Now, it sounds easy on the face value of it, but we have a lot of nuances of defining what acute pain is.
The goal, Dr. Zaffron says, is to keep a delicate balance.
The concern that I have is that we're going from one extreme to the other. We're going from over-medicating patients with pain medications to physicians afraid to prescribe pain medications at all. So we got to make sure that physicians are not afraid to prescribe pain medications, but we're empowering them to do it in a proper manner.
Well, also in an effort to combat the local opioid epidemic, both Bexar County and the city of San Antonio have joined hundreds of other municipalities across the country and filed their own lawsuits against opioid manufacturers.